A fascinating topic of conversation for people in the medical community in in all areas of the medical community, especially among internal medicine doctors, family practice doctors, geriatricians, and rheumatologists, because and oncologists, of course, that those particular subspecialties, doctors within those four subspecialties, would be um, they would be they would be well advised to advance their understanding of cannabinoids as it pertains to the treatment of their patients.
Your name? Uh,
My name's Dr. Michael Dick. I have a background in basic science research as it pertains to immunology, specifically with regard to tumor immunology and autoimmunity. Um, but I also have a ongoing interest. As a rheumatologist, I treated chronic pain, um, and had developed an interest in the use of cannabinoids for the treatment of chronic pain. It improved my understanding of the politics behind cannabinoid legislation. It also improved my understanding of the distinction between delta 8 and delta 9 THC, and the ongoing research that's currently in effect in Europe and in the United States, and even a preliminary research that's being done on anti-cancer properties as it pertains to glioblastoma multiforme. These are all areas that I was ignorant of.
oh, how did you feel about your knowledge before the training?
I had, I would say, a beginner to intermediate level of understanding. I would say that now I have more of a I'm more sure-footed in the intermediate level of understanding, and look forward to advancing my knowledge.
Thank you. And then, what's the biggest challenge you had when we talked, or biggest challenge we had as we were and learning about it?
Well, I would say the biggest challenge is really ongoing, and that is um, the uh, the potential addictive properties of delta 9 THC in uh, with regard to very high potency THC among chronic users, and and given the fact that there are 100 um, um,
Yeah,
cannabinoids
no, good.
within the cannabinoid system, and that there is a paucity of solid research that's been done on the majority of those chemicals. So I would say that's the most challenging area for me.
And you already mentioned a bunch of things that you learned. Was there anything particular that stood out that helped you?
That um, there is clear benefit of cannabinoids with regard to their ability, their palliative ability in the treatment of pain. Um, but there's still much research to be done. I would say I have a stronger understanding of that aspect of its use.
And if there was anyone who's watching and curious, what would you tell them?
I would say that it's a fascinating topic of conversation for people in the medical community in in all areas of the medical community, especially among internal medicine doctors, family practice doctors, geriatricians, and rheumatologists, because and oncologists, of course, that those particular subspecialties, doctors within those four subspecialties would be they would be they would be well advised to advance their understanding of cannabinoids as it pertains to the treatment of their patients.
Okay. Well, thank you so much for your time in this, and thank you for sharing your feedback and
My
on
pleasure.